Good evening, everybody. I'm Dr. Joseph Baker from the Almond Chiropractic Center, and I want to welcome you to this talk about tennis elbow, not just from sports. Now, before we get started, I want you to stop. I want you to stop what you're doing, and I want you to pause for just a moment, because I know exactly what most people do. I know after about 20 seconds, what you do after having this video on is you just cut it off. And in turn, in doing so, you miss some of the most important information. I know as patients at the Almond Chiropractic Center, it's part of all of our responsibilities to continually be learning, because we realize there's so many people out there that they don't know what we know. And quite honestly, if in fact they don't receive information like this, the problem is they never get this good and better information from any other sources. I want you to educate yourself, not just to help yourself get well quicker, stay well longer, but I want you to help improve the health of our community by sharing this information amongst your Facebook friends, amongst your tribe, your people, so that they have the opportunity of learning just like you and I are going to in a few minutes. In fact, I probably caught your attention already because we're talking about tennis elbow, and you're probably asking yourself, well, what's up with the vinegar, the safety pin, the mallet, the weight, and then finally the jar of almond butter? Well, I'm going to tell you, all of these play into this picture of tennis elbow. What it is, why it happens. So listen, stick around, listen to this information, learn a little bit more about it. In fact, at the end of this video, I want to introduce something brand new to you guys that we're going to probably start using here in the office, that is going to be a real interest to many out there who suffer from things like tennis elbow and other tendonitis type conditions. In fact, tennis elbow is exactly that. It's a tendonitis. It's not the muscle, it's the very end of it, the piece, the small teeny tiny piece that attaches directly into the bone. Inflammation of the tendon, that ITIS, that stands for inflammation. Now, it happens to be tennis elbow, what's called the lateral epicondylitis. In other words, it's when you hold your hand up, all right, your thumb side, the part that actually is on the outside part of the elbow, that's where this tendon attaches into. Now granted, most people, they turn their hand over, so it's on the inside, but you know what? When we look at you and we're actually evaluating the body and we're looking at it in this direction, it's actually on the lateral side. That's the proper anatomical position. But more importantly, listen, you could pinpoint. If you've ever had tennis elbow, you say, oh, I know exactly where that is, doc. It's right here. You put your finger right on top of it. And let me tell you, for any of you out there who have never experienced this and have never felt it, all you got to do is ask about 3 or 4 of your friends, and somebody's going to tell you, I've had this. Oh my goodness, it hurts like a dickens, and it sticks around for a really, really long time. In fact, the problem is that oftentimes this is a really chronic condition. One of those things that comes and goes and then never fully goes away, so it's sort of nickling at you, not for months, but for years and years and years. So listen, we're going to talk about this. We're going to talk about the fact that oftentimes it's associated with intense repetitive use. Now, I'm going to tell you, intense happens to be a very subjective word. Most people say tennis elbow because they associate grabbing a hold of a tennis racket and going through that motion in order to strike the ball, okay? Particularly when they're going through their follow through. Now they're constantly gripping a hold of this racket. There's also force from hitting the ball which affects it, but it's also that follow through and turning the hand over in order to create the spin on the ball. Intense and repetitive use. Well, let me think. There's a lot of other people who do that same type of thing, but They don't have a racket in their hand. I mean, let's be real. You have people out there, tradesmen, whether it's painters or carpenters, whether it's roofers of any type, electricians, they're grabbing a hold of a tool or an instrument. And they're doing the same exact thing. Repetitive use over and over and over again. Intense activity. See, the problem is that oftentimes we are so trained to think just because, we've stuck a label on something, that is the only way of affecting the tissues and creating the problem. Well, let me tell you, not a chance. This is one of those conditions, even though it's been given a sports-related name, very few cases are actually attached to playing sports themselves. In fact, like I said, even things like cleaning, carrying groceries, anything that causes your hand to do this. So as I look around and I grab a hold of this weight, just picking the weight up causes me to close my hand, and it causes me to activate that muscle and the tendon there. If I go ahead and try and, carry a jug of, sometimes it's milk, sometimes it's vinegar, sometimes it's just laundry detergent, but carrying a container like this causes people to feel that extreme pain. In fact, you probably know somebody, they'll tell you, hey, listen, I tried picking that up and oh my goodness, I almost dropped it. Well, the reason is because they've inflamed. They created so much inflammation in this tendon because the tissue's not able to work properly that it's running out of control. And it causes them to have that weakness that eventually causes them to have that severe pain. Well, listen, I said it's a small part. Only 5% of tennis elbow cases are actually related to a sporting condition or sporting injuries. That's an amazing figure. So you have to understand, 9 times out of 10, it's the stuff that we're doing every single day at our jobs. Every single day around the house. Our self-care, our cooking, cleaning the house, us doing our work, working out in the yard. That is how we're ending up developing this inflammation that we know as tennis elbow. Now, one of the really big signs, like I had just mentioned, is that weakened grip strength. The sad thing is when you have inflamed this tendon, which is all the way up here, well, sometimes that's not where you see the effect. Sometimes that's where you get to experience some of the signal, but not the entire thing. We have cases where it's just extreme weakness in the hand, where, like I said, your grip strength just is totally gone. And it's not okay. In fact, you've probably heard people, they'll tell you, hey, listen, can you open this for me? It's just I know it's just a jar of almond butter. By the way, I love my almond butter. This is fantastic. So, but they can't even open up the jar of almond butter to enjoy what's in it. They have to ask somebody else to open it up because trying to grip a hold and actually squeeze and turn causes so much pain, or they're so weak that they can't even open a jar like this. Maybe you know somebody out there that is exactly that way. Because in the end, we recognize that, listen, people suffer from this all the time, and they don't know. They don't know what we know. And therefore, part of our responsibility is to make sure that, listen, they at least get checked. Because, as a reminder, and I brought up the safety pin, this is exactly one of the reasons why this type of a condition happens. See, your body doesn't care where the bone comes out of place. Your body doesn't care, what the trauma, what the incident is, whether it's repetitive, whether it's an impact injury. Here's the thing. As soon as those bones come out of place in your body, whether it's in your spine, whether it's your elbow or your wrist or your shoulder, and it produces more strain on those muscles, the muscles are going to work harder than they're supposed to. When they work harder than they're supposed to, well, guess what? It's going to create that inflammation. See, and the problem is ultimately getting back to the true reason why the body is operating the way it is. If the bone's out of place, and there's this lack of proper function, we have to restore that function so that that muscle that was designed to do a job is able to do exactly that, the job that it was created to do. No, tennis elbow is not normal. Is it common? Yes, it's common. There's a lot of people out there that suffer from tennis elbow. And yet, people suffer needlessly thinking they have to simply live with it. So the very first thing is making sure that you're getting to that root cause of why it is this is happening. Sometimes it's just very local, like I said, that direct trauma into the tissue, into the joint that's causing that bone to be out of place. Other times, it's a referred problem coming from your neck all the way down through your brachial plexus, creating that. Regardless, we need to make sure that we're getting to the root cause. Listen, there's a lot of things that you can do. And if you've never had anybody explain some of those other things that are able to be used to help to actually deal with, the pain, the discomfort, very naturally dial that back and allow the body to move forward more quickly, well, using RICE rule. RICE stands for rest, ice, compress, and elevate. Now, many of you have seen, ice being used. Obviously, resting it makes a lot of sense because it's an overuse syndrome, so the more you use it, the worse it gets. The ice reduces the inflammation. It stops the heat reaction, and that's what inflammation is. Compress it, so you take some of the strain off the muscle. Elevating this just simply helps to evacuate some of the swelling. But you can also use what's called cold laser therapy, something that we utilize here in the office. We've been utilizing it for, at least 10 to 12 years now. That helps the tissue not only experience pain relief, but also turns the cells over more quickly so that they're able to heal more rapidly. Some of you out there have experienced this. It's a wonderful tool, all natural, nothing artificial goes into the body. It is a painless, simple process. In turn, there's also ultrasound, which helps to also increase the blood flow into the area. And finally, one of the new technologies that I was referring to is actually what's called pulse therapy. And this is a fantastic product. It helps to actually increase the metabolism in the area. It breaks up scar tissue. It helps to make sure that the tissues are actually driven through the healing process more quickly. And I love that because in that total conversation about all of these different things, nothing foreign, nothing artificial is being added into the body. In fact, in the end, it really requires our body to do exactly what was designed to do: heal. When you get a cut, you don't have to tell your body to close up the wound. When you get a cut, your body doesn't have to be told to put new tissue down, remove the scar. Oh no. Once you set it in motion, it knows exactly what it's supposed to do. All of these things only guide the healing process. They only make sure that it's stimulated to happen a little bit more quickly. But the wonderful thing is that it's capable of helping to eliminate and shorten the healing process a tremendous amount. I've personally experienced this. I know others who have gone through this also. So in turn, it's going to be one of the things that we're going to continue to talk about. It. We'll bring this conversation to the table more and more. You'll be getting more information about that pulse therapy here in the office in the near future. Now, I'm going to encourage you. We always talk about what our responsibilities are. Our responsibilities as a patient, listen, we're going to like this video. In the comment section, I want you to leave me a message. I want you to leave me the message of, hey, listen, this is a question that I had about one component of what you talked about tonight. Maybe it's about one of the therapies. Maybe it's about the laser or the pulse therapy. Maybe it's about, hey, listen, how can I work on this at home myself in order to help to make sure that I'm doing my part to help in the healing process? Maybe I know somebody who needs to know what we're talking about tonight because they've been suffering with a tendinitis situation for a really long time. Listen, in the comment section, leave me that message. Next time you're in the office, I want to hear your conversation, but I'm going to be looking for it in the comment section. Finally, share this. Share it amongst your friends. Listen, to me, it's one of those great blessings we have. It's simple, it's easy, and yet we never know how far-reaching that's going to go in somebody else's life. I'm Dr. Joseph Baker from the Limmer Chiropractic Center.